I'm Councillor Judy Villeneuve. I'm the acting mayor, and I apologize that we get tied up in another meeting for the lateness of the meeting, and so at the same time I'm going to have to ask you to make your presentation succinct because we have two meetings after yours scheduled before 6. So we just had some business that held us up. So if I could just ask the first delegation, Michael Buda, to come forward. And Mike, I want to tell you, I was on a panel with Mike last week in White Rock at a transportation forum, and he did a terrific job. So looking forward to your presentation.
Great. Thank you, Acting Mayor. I'm going to spend about 10 minutes taking you through the Mayor's plan and our plans for the referendum campaign as well. And thank you very much.
Mayor Hepner suggests 5 minutes.
5 minutes? We can do that, absolutely.
We all know and love the plan.
Yes.
Oh, good. I should say I'm joined here by Jesse Kohler and Don Buchanan, who are both from the Mayor's Secretariat, and Don, as you likely know, is a seconded staff from the city, which we very much appreciate. So to move right into the plan, I think you know that the Mayor has really started from the first principle, which is this plan needs to ready the region for growth. There's 1 million more people coming over the next 35 years, or in the next 25 years. In Surrey, I think you know this even better, that population growth here is driving almost every decision you're making, and the mayors knew that they needed to ensure that this region, this sub-region, the city, had the transportation network in place to accommodate that growth. And that when they put together this plan, they knew that it wasn't just about providing transportation to each of the 21 municipalities in the region, that in fact we needed a transportation network to connect the region. I mean, as you see here, 6 in 10 residents of Surrey leave Surrey to get to work. 4 in 10 are leaving Surrey for all their trips to shop, to visit friends, family, go to sporting events, what have you, which meant that the mayors had to put together a plan to serve both local and regional needs. And as the mayors are developing their plan to improve the transportation network, they only had to look at the recent past to know how effective these kinds of investments could make. So for instance, over the last 10 years, we've seen an 18% increase in the region's population, yet total traffic volumes across the 5 major Fraser River bridges are flat. We're doing something right. Over the last 6 years, transit service hours south of the Fraser have increased by 11% and riderships up 15%. Again, we're doing something right. The mayors knew that they had to continue those kind of trends because the growth is continuing and in fact accelerating. So they spent most of last winter and spring developing this the mayor's vision, the mayor's plan, which I think you know is based on existing plans that are already there, existing municipal plans, existing regional plans. And I think you've seen this map before, so I'm not going to go through the details, but this is the mayor's plan that we're here to talk about. Before I go into the details for Surrey, of course, you know, as all good mayors do, the first thing the mayors thought about was how do we pay for this plan? So, you know, no surprise, it's through increased fares from, in fact, providing more transit, from toll revenues on the new Petula Bridge, new regional revenues, which I'm going to talk about in a little bit, and then funding partnerships with the federal and provincial government. A question we're getting a lot, and certainly Councillor Villeneuve heard it in White Rock last week, is if I click the yes box, how can I be sure that the $250 million a year metric Vancouver congestion tax, the regional sales tax, actually will go to the mayor's plan? You'll see right in the ballot that the mayors are really committing to put that money in so-called a lockbox, something that is dedicated to implement the mayor's plan, not just dedicated to transit and transportation, dedicated to the 34 projects that are listed in the mayor's plan. And that will undergo independent auditing and reporting in public. So this is very different from really any other tax that's collected. It's dedicated not just for a particular activity, but for specific projects. It'll be kept in a separate reserve account and independently reported and audited. I think it's really important for the public to know that. So to go through the mayor's plan really briefly in Surrey, I think you know all these details. Obviously, the new rapid transit projects are really the foundation of the plan here in Surrey, the backbone of the new transportation network south of the Fraser. In fact, these LRT projects are the region's most significant passenger rail investments since the completion of the Expo line in 1996. If the LRT is the backbone, the arteries of this plan are in fact the increased bus service. So region-wide we'll see 11 new B lines, including 3 new B lines, which are express rapid bus lines right here in Surrey, as well as, and I think this is the most significant part, significant additional bus service in Surrey. So using the existing fleet, which means we can begin these improvements as soon as 2016. We'll provide more midday, evening, and weekend service on virtually all the community shuttle routes in South Surrey, Newton, and Guildford, which will improve connections to rail and other frequent transit networks. And then as soon as some of the 400 new buses, which we'll be able to order after a successful referendum, as soon as those new buses come on, we'll be able to expand bus service to neighbourhoods which have no service presently. So Clayton, Grandview Heights, Morgan Creek, Southport Kellis, Annandale. So these are the kind of things that are going to happen very quickly. They do not rely on federal provincial investments. These are things that with a yes vote we can start planning almost immediately, and indeed we'll see some of the service improvements within a year. Another really important part of the plan that I think gets overlooked, we'll see a four times increase in the capital investments available for improving the major road network. So you see that in the map here. These are all the major roads that are serving both Surrey and in fact the region. So that total investment envelope is going region-wide from $190 million to $750 million. That doesn't include $1 billion to replace the Petula Bridge. So very significant investment in the major road network. I think you know all about the Petula Bridge. Certainly happy to answer questions afterwards. And then I think it's something else that's frequently forgotten is there'll be a significant investment in the existing rapid transit lines. So we're actually increasing service on those existing lines by up to 50% to reduce overcrowding and all the rest of it. I know that many of you experience as you try to, in morning rush hours, you try to leave the Surrey region, you'll see full trains. We'll see that problem addressed. So where does that leave us? At the end of this plan, we'll see the number of residents and jobs within walking distance of an all-day frequent transit network increase by 3.5 times. So what is a frequent transit network? That is transit that comes every 15 minutes or better all day and into the evening. And so that means if you walk out to your local frequent transit stop, a bus will come on average every 7.5 minutes. What that means is people are no longer adapting their day and their needs to transit schedule. Transit is there to meet their needs. And that really changes the way that people see transit. As I was saying earlier, we'll be implementing this plan beginning immediately after a yes vote, and we'll see improvements to existing bus routes, especially in off-peak hours, within a year and maybe less. We'll see improvements, expansion of the bus service to new neighbourhoods that are currently not served by transit within 3 years. We'll be starting on the LRT line as quickly as we get commitments from federal and provincial governments. And indeed, actually, that work has started already. Surrey is working with TransLink on the next phase of design studies. So in fact, in some ways, that project is underway right now. So that really brings us to today. So we've got, I think as everyone knows, a referendum coming up. The voting period begins March 16th, extends to May 29th. The ballots will be mailed and arriving in people's houses on March 16th. People can register anytime between now and May 15th if they're not already on the list. People are actually already registered if they voted in either the last provincial or the last municipal election. So most people will already in fact be registered, but certainly we'll be working with the city to ensure that people are aware of the vote, aware that they need to register, help them register, and then help them actually fill out the ballots. So that's it. Certainly happy to answer any questions, but I do have to say that this team at the Referendum Secretariat, which includes, as I said, city staff, are feeling very positive about the plans. The next 2 weeks we'll see a significant ramp-up in our campaign activities, including rollout of our ad campaign, a significant increase in direct contact with voters to ensure that people are informed as we head into the beginning of the voting period on March 16th.
Excellent. Thank you very much.
Yeah.
Council member have any questions? No. Well, thank you so much for your time coming out today. Our next delegation is Emily Watson, who's the Manager of Demographics and Facilities Planning. So with the school district. Thank you.
Good evening, Acting Mayor, Member of Councils. My name is Emily Watson. I'm the Manager of Demographics and Facilities Planning with the Surrey School District. I have with me this evening Tina Monroe, who is our Senior Manager of Business Management Services. We're here tonight at the request of Council to give an overview of how we do our enrollment projections in the district, and I'll just then touch a little bit on our development referral response template that we provide to you during the development application process, and briefly our capital planning process. So we do projections for 1 to 10 years. We actually do a longer term horizon as well. Our year 1 projections are very critical for a number of reasons. They are the basis on which we build our budget, on which we staff our schools, on which we move portables, and we get ready for September. We just finished our projections for next year at this current point, and now we're looking at our facilities and where we might need some additional capacity to accommodate the students. We do longer range projections to inform our capital planning process. Annually, we prepare a 5-year capital plan that we submit to the ministry. We also work on a long-term facility and education plan that we're in the process of making. And these longer range plans help to inform our eligible school site proposal that you saw the other month for the school site acquisition charge. So there's a lot of factors that go into developing enrollment projections. The basis of the projections is the existing population of school-age children in a particular catchment, and we get that information from the CRA annually. We then look at what might happen to that population over the year based on development that's going to be occurring, the way the demographics are happening, migration. We work really closely with city staff on monitoring new residential development. Your staff provide us with a list per school catchment of the estimated number of units for the next 20 years, which is really helpful for our process. This year we got the current building permit approval activity given to us spatially, which is very helpful for us to help track development as it occurs. We look at what percentage of the population would normally attend a local school. So if there's 100 5-year-olds in the catchment and 75% would normally participate in that school, our K projection is 75. We look at out-of-catchment enrollment trends, which varies per school. We look at birth rates, and we look at new registration information. We also work closely with the schools, who are the principals or sort of local experts at what's happening, if there's a new trend or an anomaly in last year's figures, trying to figure out whether that's the start of something new or just a one-off. We have an enrollment projection software that kind of helps bring all those pieces together, and this is just a screenshot of it. So there's lots of moving pieces. The middle graph is the total population in a particular school catchment, and then the other things around it are what help to shape the population, so the migration rates. If it's a catchment with sort of an explosive level of development, we actually zero out the migration and we use a housing module, and we'll work with city staff to estimate the number of new units that are going to go into that catchment, and that applies that directly to that school. The student yield rates we use for new development varies depending on the type. So obviously single family with secondary suites have the highest yield of students, and high-rise residential tends to be the lowest. So this is a screenshot of what you've probably seen many times, which is our standard response template for development referral process. So the red circle shows the projections for the impacted schools. And that's done based on the methodology that I just explained to you previously. The green circle is the projected gross student yield from a particular development. So where the development is aligned with longer range planning in neighborhood concept plans, and it's sort of been on the horizon with the conversations that we've been having with city staff, they're generally already built into the projections that are in the red circle. If it's looking for a significantly greater density than was originally anticipated, it might change that projection. So we'll often allude to that in our commentary in the blue circle, as well as what we're planning to do from a capital and space perspective for those particular schools. This is designed to help you with your decision-making process and to convey any opinions that we might have on the matter. So we're always interested in feedback on how this could be improved to help you with the decisions that you have to make. So as I mentioned earlier, enrollment projections are critical for our capital planning process. The Ministry of Education transfers the responsibility for planning and managing capital projects to boards of education. However, they retain public accountability for ensuring that schools are planned, designed, and constructed and maintained in a cost-effective manner. So that means that although we might develop a 5-year capital plan and prioritize that as a district, we aren't the agency that determines when the capital funds are released for a particular project. So that can create some uncertainty about when new projects are coming online. And then even once the ministry receives our capital plan, they have their own process to prioritize projects across the province, and they seek their own approvals through the Capital Planning Secretariat. Building new space takes time. There's a long lead-in, so even before we can be considered for capital funding by the ministry, we have to do sort of a pre-feasibility plan, which sets the context for, the business case for a new school. At that point, we get a preliminary approval, and then we move into what we call pre-design, which is another level of feasibility planning, refining the scope and budget, and then we get approval and move into design, tender, and construction. So for a new secondary, even from the word go, from the ministry, we're looking at 4 years, and for an elementary, 3. Obviously, that can change depending on the context and the design and that type of thing, but that's generally the way it goes. So it really hinges a lot on the longer range planning, the neighborhood concept plans and those types of things, because when a school opens, basically the feasibility planning for that school was done 5 years before. So if things change during that time, it's difficult to react in a timely manner. One of the unique things about Surrey is obviously the pace at which it's growing. We operate approximately 280 portables on our sites due to a lack of physical space. The funding to run and maintain those portables costs us about $4 million annually. And that comes directly out of our operating budget, not our facilities budget. So the ministry funds has a per pupil cost or a per pupil rate that they fund on. And they do have a list of adjustments to cater for local and regional context. And most of those are for small communities, rural communities where there's lower enrollment. So the Surrey School District is currently advocating right now for an adjustment to the formulas to accommodate our unique circumstances that are created by this rapid growth, particularly when the capital investment doesn't come at the same time. So that's just something that we're working on. So I'm happy to answer any of your questions, and if I can't answer them, I can get the information back to council at a later date.
It's a laudable goal to be working on that issue. I've been working on it since 1990, so I hope it's successful. Can council members want to ask any questions? Mayor Hepner.
Thank you. And thanks for your presentation. Can you just tell me, when you assess the number of students that you assume will be in a particular development based on its density, do you ever go back and say that assessment model is working because the numbers are in fact happening, or the assessment model needs to be rejigged or is skewed in some fashion? I'm just wondering how accurate it is, because lots of times at a public hearing we hear a lot of laughter on, ha, we're going to get a lot more students than that. And I just want to get a sense of your assessment of the accuracy of those numbers relative.
Through the chair, we do go back and look at them. The template that we use for the development referrals really applies sort of an average rate across the district, and that can vary wildly depending on the development. Some developments just happen to cater for families and hit the mark just with a specific floor plan. So yeah, we go back and look at it, and so as an example, we were probably under on some catchments like CIC, where you have the laneway houses and suites and those types of things that are really pulling a lot more school-age children out than we thought. But in general, they're pretty accurate. I was actually in discussion with city staff recently about getting together to do just that and have a look at some of the more recent developments, in particular the townhouses, to see what the actual student yields were. So one of the things that's important to remember, though, is it's just school-age children. So you might have a household that has a baby and a 2-year-old and a 3-year-old, but there's 0 school-age children. So that's why it can sometimes be a little misleading, as it's only the 5 to 17-year-olds that come out of there.
Thank you. Thank you. Any other questions? Thank you so much for your presentation. That's helpful. And our next presenter is Jane Adams, who we all know, the President and CEO of Surrey Hospital and Outpatient Center Foundation. Is it Ann Libiter that's joining you as well? I'm doing all right.
Good evening.
I'm getting
Acting Mayor, Councillors, City staff. I'm here with Andy Libiter, the Executive Director of Mental Health and Addictions at Fraser Health, as well as the Executive Director of Langley Hospital. And we'd like to speak to you tonight about a topic that is critically important to all of us, the good health of our children and teens, our future. Tonight, we wanted to tell you about the Child and Adolescent Psychiatric Stabilization Unit, commonly known by the acronym CAPSU, a 10-bed unit scheduled to be built at Surrey Memorial Hospital for children and teens in extreme mental health distress. When Fraser Health came to us about CAPSU, we knew this was a project with impact, a unit that would address the growing number of children and teens among us suffering from mental illness, a unit that would strengthen the safety net for families in Surrey and the entire region. Fraser Health already had more than 90% of the funds they needed for the unit. They simply needed the final $1.25 million to furnish and equip the unit. The Foundation saw a wonderful opportunity to work with our community to get our children the care they needed. We wanted to be part of a solution that will prevent children and teens from hurting themselves, potentially turning to street drugs, or perhaps even life on the streets, a life of isolation and hardship. Andy Libiter, the Executive Director of Mental Health Programs at Fraser Health, will provide a snapshot of the need for this unit and details about how it will support the continuum of services already in place in Surrey. Andy?
Thank you, Jane.
Thank you, Jane. Thank you, Acting Mayor, Council members. So what I would like to do, and I'm very aware that cognizant of the time, so I will be quick, but I would like to go through and tell you about this, some demographic context, to describe for you the mental illness incidence in young people. I'll briefly touch on our current service configuration, and then talk about one signifier of increasing demand, and that's admissions to emergency rooms in Fraser Health and emergency room visit rates. I'll then describe CAPSU and the benefits, and finish with timelines. So with this slide, you can see that Fraser Health has 30% of the children and young adults under the age of 24. And of that 30%, between 17 to 20% may well experience mild to moderate mental health issues, and those will and can be addressed through access to primary care. 7 to 10%, however, will have a more serious mental illness, such as anxiety disorders and depression, and they'll actually require a range of secondary mental health and substance use services, including potentially hospital admissions. And lastly, 3%, and you can see the numbers there, around 15,000 young people will actually be affected with an emerging serious mental illness like schizophrenia or bipolar disorder. It may surprise you to know that half of all lifetime mental illnesses begin by the age of 14, and 75% begin by the age of 24. This is the principal reason that we have to invest in our children and young people. The onset of most mental illnesses typically occurs during adolescence, so things like depression, eating disorders, substance abuse and dependence, and of course suicide and self-harm. Suicide is actually the 9th leading cause of death for adults, but with children and youth it's actually the second leading cause of death. Severe mental illnesses, which can take a terrible toll on individuals and families, typically present in late adolescence and early adulthood, so things like schizophrenia and bipolar disorder. So the point I want to make is mental illnesses really peak and they manifest when these young people are exquisitely vulnerable in terms of their development. Of course, we know that adolescence and young adulthood is a very complex period of biological, cognitive and psychosocial development, and of course a mental illness can really seriously slow and interfere with that process. Rate of incidence. It's a little bit complicated, this slide, but if you look across the bottom, it's age, and if you look up on the left axis, it's a rate per thousand population. And there's different colors there. So you'll see between the ages of, say, 10 to 30, there's that large yellow spike. That is actually mental disorders. Sorry, I should have clarified. This slide shows incident years of lived disability. So you can see from this slide that mental illness is the problem for young people in terms of lived disability. It's not motor vehicle accidents. Obviously it's not musculoskeletal injuries. It is mental illness and substance use. How are services organised within Fraser Health? At a very high level, community mental health services for children and youth are provided by the Ministry of Children and Family Development, and acute care, crisis response, adolescent day treatment programs are provided by Fraser Health, and early intervention services like early psychosis intervention are provided by both. In other words, it's a bit of a complicated system for families and youth to navigate. There's a continuum slide there, and if there's more time I would go through it, but I'm going to skip over that. I want to draw your attention to this. I mentioned that admissions and visits to ERs is one signifier of increasing demand, and you can see over a number of years we've averaged around 650, 700 admissions into our ERs of children and youth presenting with psychiatric disorders. And I would say that we've struggled, even when it was 650 to 700, to find adequate treatment dispositions and services for those kids. But in 12-13, you'll see this, what we thought was a huge spike at the time, where the number went from 677 to 1,000. And our assumption was, our hope and our prayer was, that this was a spike. But it wasn't. And what we've seen is that the number jumped again to 1,200, and all indications are this year that we are certainly going to be on track for that or slightly above. When it comes to admissions, the picture, to visits, again for psychiatric and substance use reasons, the picture is one of a steady but alarming increase. So you can see between 12-13, we were at 2,000, we went to 2,416 last year. We've already exceeded the 2,400 figure now, and we're probably on track by the end of the fiscal year to be approaching 4,000 visits. So as I say, it's just one indicator, and if my colleagues from MCFD were here, they would be certainly talking about the incredible pressures on their community services. So what are we doing to respond to that need? Well, the causes are probably multifactorial, and we have to respond in a multifactorial way. So we're certainly accelerating our efforts in Fraser Health to work with and collaborate with MCFD. There is a provincial collaborative process that's underway, and it's bringing together divisions of family practice, school districts, MCFD, Fraser Health, people like the Force Society for Kids' Mental Health, to really look at how we can serve children and youth in a much more coordinated and holistic way, and hopefully intervene at the right time, so that's early intervention, and prevent so many kids actually turning up in our emergency rooms. And then lastly, we want to establish, as Jane said, a child and adolescent psychiatric stabilization unit. What is that? It's a short stay assessment and crisis stabilization unit for children and youth. The age range will be 6 to 17 years. We may consider 18 for admission on occasion. And this is for kids that are really turning up in acute psychiatric crisis where we cannot safely manage them in the community. The unit will run full out 7 days a week, 365 days a year. So there'll be no downtime at weekends. We'll be providing assessment, consultation, treatment services through the average length of stay, which is, as I say, 5 to 7 days. We will be building the unit to manage high acuity patients and those that are at risk for elopement and self-harm. And it will be staffed by a specialised multidisciplinary team with dedicated child and adolescent psychiatrists. What will be the benefits? We're very convinced that this is going to be an improved response for children and youth in acute psychiatric crisis, and we'll be much better able to match treatment to need. We will link the CAPSU very closely with other services, including those in MCFD, so that we don't just stabilize the kid and help their family and then discharge them and see them relapse into crisis. We will be reducing admissions of children and youth to unsuitable and unsafe environments. Currently, we have 10 adolescent psychiatric beds, and that's it. So where do we put all those other kids? That's 650. We're admitting them to adult psychiatric units, which is less than optimal, and we're admitting them to pediatric units as well, where it is safe to do so. Again, good care is provided in those environments, but it's not recommended optimal care. So with CAPSU, we'll be able to reduce, I would even hope maybe eliminate admissions to adult psychiatric units and pediatric units. And most of all, we'll be able to dramatically reduce the long length of stay that these children and families experience currently in our emergency rooms. Time and location, we intend to locate the CAPSU on the Surrey Memorial campus. We have an area identified already, and we anticipate opening the CAPSU in September of 2016.
Thank you.
Thank you.
Thank you so much for that presentation. It's a really important initiative.
Jane, did you want? I think Jane just wanted to.
So Jane, can you conclude?
Yes, thank you very much. I just wanted to ask if it's possible, if the Council is sympathetic to this need, if the minutes of the meeting will reflect that you endorse the need for this unit and the urgency to have it built in the community at Surrey Memorial Hospital. And also we wanted to extend an invitation to members of the Council and any senior staff who are interested in having a bit of a tour of the pediatric services and mental health services we already have at Surrey Memorial, and to get a sense of where the unit will be located. So if the minutes could reflect, Acting Mayor, and if our invitation could be reflected in the minutes as well. Thank you and good evening.
Okay, thank you very much. We appreciate your presentation. And council members have any further questions? Councillor Mira Hepner, I see.
No, I was just going to say I think it's important that we do reflect in the minutes that we support, very strongly support, the inclusion of the CAPSU project and consider it an urgent matter for Fraser Health consideration.
And I'm sure all council members back that motion. And Councillor Hayne.
Thank you, Madam Chair. I just wanted to say specifically to Jane Addams how thrilled I am personally that the Foundation is becoming involved in this. Certainly the Foundation was on the leading edge of helping to fund and promote Innovation Boulevard with Dr. Ryan Darcy, and took a leadership role there. And the organization is just so progressive, and really pleased to see you here because it's so needed. When we look at those statistics of those increasing numbers of youth presenting, if that was cancer or cardiovascular disease, we'd be just running around trying to figure out what on earth in our environment or what is causing this, and I'm sure we don't have all those answers, but clearly we need this facility, and I'm so pleased that the Foundation, as I said, is taking a leadership role here. Thank you.
Thank you very much, Councillor Hayne. Well, thank you all three delegations for this afternoon, and if I can call for a motion to adjourn. All those in favor? Opposed? Carried.